Good welcome and good evening to all the participant in this IIHP webinar on 2nd May 2021. IIHP has started this initiative since the lockdown had started to learn and to bring the teachers at ease of our home and our gadgets. So we have been conducting these webinars under the able guidance of our leadership, President of Honor, Dr. V.K. Gupta sir, Padam Shri, Dr. M.A. Rao sir, President, and whole of the CEC team. We have been conducting these seminars twice, earlier a weekly basis and now twice a month. And many teachers have participated and have contributed to the richness of the knowledge. All these videos are shared on YouTube later on. So all these webinars, they are attended by the doctors and very senior doctors all around the world. Team are doctors from whole of the world, they join these webinars. And these webinars, these are bringing a lot of interaction, bringing many of the teachers, and teachers get accessibility to the student to the different part of the country. As IIHP is the largest organization of qualified homeopathic physicians and institutionally qualified physicians and recognized by the government, even the government policy making, IIHP plays a role. Recently, we have been undergoing many tough times where people have been struggling with the COVID and we have lost great teachers in this. This last webinar was by Dr. Praful Borkar, who is a direct disciple of Dr. Praful Vijayakar sir. We all know that this COVID has took Dr. Vijayakar sir away from us. Untimely passing away of this legend has really hurt so many lives. And now today again we are tributing to Dr. Vijayakar sir as one of his students and very close associate, Dr. Rajesh Sofat, is today with us. He'll be talking upon the renal diseases, and he's the president of IIHP in Punjab State Branch. He has done a tremendous job by distributing and leading the team of distributing arsenic album, and for which he has got a recognition in the form of Punjab getting an award in distribution of arsenic album. And secondly, he is also a teaching faculty into the Lord Mahavira Homeopathic Medical College. He's closely associated with the predictive homeopathy. So not taking much time, I invite Dr. Rajesh Sofat ji to start his presentation on the subject cited, and hope you all will learn a lot of new things. So he'll be talking of around till say it's 4:40 now, and he'll be talking till 6:10 or 6:15, and then we'll have a question answer session and we'll conclude in time. So I welcome Dr. Rajesh Sofat to this platform of IIHP webinar. Dr. Rajesh, please start with your presentation.
Thank you, Dr. Muktinder. And good evening to everyone. So am I audible?
Yes, you are audible. Your screen is visible.
Okay, thank you. So I'll start with my today's topic. So first of all, I'll start with the tribute to Dr. Hahnemann, so who has gifted us a beautiful science of homeopathy, which has power to reverse the process of the disease. So if I'll just understand more into it, that how this started, we all know about it, that it was just his experience with the bitter cinchona, from which he further gave a thought to his brain, and he came up with the sweetness, that is sweet little pills, which is actually a divine science which can reverse the process and can make the person normal. So actually it was a thought process, so which gifted us this science. So if I try to understand more about it, then the legends, Dr. Kant, Dr. Boning Hassan, Dr. Allen, and then Dr. William Borick, they followed the basic principle of Dr. Hahnemann's similia, but they always try to find out the cure with their thought process. Dr. Kant came up with will, moral, and intellect. This was his principle of prescribing. And then Dr. Boning Hassan with his location, sensation, modality, concomitant, and then Dr. Allen with the keynotes, and then Dr. William Borick with the pathological. So they all tried with different understandings. So actually I'll name it that these were the thought process which were generated in their mind. And what I understood is that this science is actually ocean. So if you will start from any side, you will keep on understanding and harboring the same process and going deep and deep and getting the laurels. So it is not that why Dr. Kent has not thought like Dr. Boning Hassan, why Dr. Boning Hassan has not thought like Dr. Allen, or why Dr. Allen has not thought of pathological prescribing like William Borick. So it was the individual process. So once you have understood the process of similia, the basic principle, and the second thing that you need the patient to bring back to the cure. So it is that you are trying to bring back the person normal with your understanding. So not only these legends, but many more, Dr. Herring, and then Dr. Lippi, Dr. Nash, and so on. These were the continuous. And in India, Dr. Kanjilal and Dr. Phatak, they were very popular, but they had their own experience, and they try to understand everything about homeopathy with their experiences. So in the same way, my teacher who has guided my path and to whom I am connected is Dr. Praful Vijayakar sir. So since 22 years, I am with him, and still he is showering his blessings on me. I never thought that he has left. It is just a matter that he's not present here, but dynamically he is uh, guiding every follower of his. So I followed him, I understood him, and his thought process was that homeopathy is a mathematical science. and the scope of it is limitless. So I have seen the blind, they are getting eyes. It is his thought process that homeopathy is not meant only to treat cough and cold. This can give uh, eyes to the blind, and this can give hearing and speech to deaf and dumb. And only thing is that if you have understood the process of disease clearly in a mathematical way, if you have qualified the symptoms clearly, if you have understood the totality completely, then you will be able to cure the person completely. So my today's topic is a little heavier topic, that is of renal failure. Since many years I was trying to treat uh, the cases of renal failure, but I did not get success in the early days with this disease, because sometimes they got improved and then the status quo came, or they got aggravated, and slowly the decline came. So, and ultimately I have seen many of the patients, they were slowly progressing to the uh, collapse. So for me, what I understood is that renal failure is actually a slow death. The other name to it has been given as renal failure, end stage kidney disease. So let us understand or brush up little bit about this disease. So this is a medical condition in which kidneys are working less than 50% of the normal levels, and then the triggering and then the process, and ultimately this comes up with full flourish. So classification of renal failure, acute renal failure, then we know that this is chronic renal failure or chronic kidney disease. And in between, I have placed this thing that is a nephrotic syndrome. And nephrotic syndrome patients, if they are not treated properly or completely, they slowly go down again into chronic kidney disease, and slowly they go into collapse. So you may be able to see this is the center line in a patient. This is a case of acute renal failure. This is a case of chronic renal failure. And this is for the dialysis, central venous cannula or central line. And this change, if we can bring. So this is not only possible, this is not possible with the allopathy. This can be done only with the simlimum. And then a very beautiful case of nephrotic syndrome. He came when he was only 6 years old, and then slowly with the change, he got completely cured. And now after 13 years, he came to me for treatment of acne only. So he has no signs and symptoms of this nephrotic syndrome after 13 years even. So we will discuss the cases of acute and chronic renal failure now. So some information about acute renal failure. Sudden decrease in renal function characterized by increased serum creatinine level and urea, or decrease in urine output, or both, develops rapidly and may resolve completely. So in the acute renal failure, so there is chance that patient may resolve completely with the allopathic medicines also, but with homeopathic medicines also. But if the person is treated with allopathy, then the chances that of relapse of this disease are sure. But if we are treating it with the similimum, then he get completely cured and remains healthy throughout. So this I have seen. So causes of acute renal failure: pre-renal, due to decreased blood flow to the kidneys, dehydration, sepsis, blood loss, cirrhosis, heart failure, cardiogenic shock, etc. And then renal failure due to damage to the kidney, glomerulonephritis, tubular necrosis, and certain antibiotics. They can also cause the renal failure. So then is the post-renal causes due to blockage to the outflow of the urine, renal stones, bladder cancer, benign hypertrophy of prostates, narrowing of urethra. So all these are the causes which we should know before treating the case, or these should be in our mind. So I know that everybody should have, everybody might be having the causes in the mind, but still I am just brushing up. And this is very important part, that complications of ARF, metabolic acidosis. So there is imbalance of electrolytes and increase in the acid because of this renal failure. And then high potassium level, hyperkalemia, and then uremia, hyperuria or urea increased. And then finally, this again goes into chronic renal failure. So ultimately, from metabolic acidosis, high potassium level, or uremia, the chances of developing chronic renal failure are sure. If it is not treated or intervention is not done at the right time, though a process is self-sufficient with allopathic drugs or with the conservative treatments, that patient will land up into the chronic renal failure. So I'll start with the case of acute renal failure. She came to me with the complaints: pain in right side lower abdomen. She was unable to lie down on any side. Was especially lying on the left side, was stretching the legs, severe pain, aching, can lie down and sleep on right side only. Aching, can lie down and sleep on right side only, with knee folded and elbows touching knees. Nausea plus vomiting, worse while drinking water, no desire to eat anything during pain, grinding teeth, better by drinking sips of water, folding of legs ameliorates the pain, slight intake of solid food aggravate the pain, thermal thirst, she was chilly and thirsty. Now the most important part is the history. She lives in Ludhiana, went 1 month earlier to UP to attend a marriage with her in-laws. She was pregnant of 8 months. There her sister-in-law insulted in front of everyone that she did not show interest in the marriage. She not shown care and respect of relatives. She explained her, but sister-in-law was not ready to hear anything. She felt insulted and had lot of anger about it, but she did not say anything to her sister-in-law. Same night, she had pain in right side of abdomen, for which she was admitted to the hospital. Labor pain started and she delivered a baby. She was told next day her baby was dead, but she did not believe on it and started shouting, "You gave my baby to someone," and that she herself seen a live baby. She did not allow me to see my baby. Where is my baby? She started considering everyone wrong, husband, hospital staff, and family. Everything done to treat her was also wrong. The treatment given as well they are giving was also wrong. After that, pain in abdomen increased, and in ultrasound, right kidney was enlarged and creatinine came to 7.6. So dialysis started, but she used to respond with that for time being. Again, creatinine gone up. Dialysis twice a week started, but she was not showing any signs of improvement. She was brought in the same condition from 1500 kilometers to me as I treated her mother 4 years earlier for cirrhosis of liver. So these were her reports of 7/5/2017, uterine pregnancy of approximately 32 weeks, right kidney swollen and echogenic, mild hydronephrosis with dilated renal pelvis, measuring approximately 4.3 centimeter in AP dimension, fluid average level seen within the dilated collecting system, left kidney not visualized in renal fossa, and common ectopic location, gravid uterus with live intrauterine pregnancy of approximately 32 weeks. Rukuni Devi, and this was the report. And her HB gone down to 9.6, TLC 11,100, and serum creatinine 7.6. These were the reports which she presented, and I am going to show the video. So is everything okay? Dr. Singh, I am audible?
Yes, yes, you're audible. Everything is going fine.
So I am starting with the video. So I request everyone to just observe this video. Our voice may be low, but observe.
I think you can explain because there's no audio, so you can tell along that what she's saying.
I don't know, the video is very slow. She was constantly complaining of the pain. She was not able to sleep day or night. She was continuously saying pain, and uh, she was not able to sit for a while. Sometimes she was leaning on the table, other times she was going back. Uh, if you can see, just see. So she was lying on the table, then she lifted her legs up on the chair, but she was not getting relieved from the pain in any position. So this was the case how presented. So the thing is how to solve the case. So the thing is that she was uh, prescribed the allopathic medicines along with the dialysis was tried twice a week, and the condition was that she was in the hospital. So now how to solve the case? Only thing is that if we can focus on to the symptoms, but the video was not clear. The video was moving very slowly. But if we focus on to the symptoms, then we can reverse. And I have found some of the positive quotes because this disease is like this. So fixing the target is beginning. Once you fix, you can achieve, and efforts are needed to achieve. You should start the effort and you should continue with the efforts, and you should never give up even if the situation or the circumstances are not favorable, like in this disease, dialysis, drugs, criticism, and opinions of uh, allopaths and the family. They all stop your working and they are not allow you to work, but still you should continue. And what I found is your best teacher is your last mistake. If you think that you have committed a mistake and so you should quit, then you won't be successful. But if you keep on learning from your mistakes, then one day you will get the success. So for me, it is like success is sure if you commit mistakes. And then how to solve is actually organon, and organon is a blessing. It is like spoon feeding. If you have understood the process of disease clearly, then you can understand and solve the case. So for this aphorism 3, this I use almost in each and every case because this aphorism solves almost all of my cases. So if the physician clearly perceives what is to be cured in disease, that is to say in every individual case of the disease, that is the knowledge of disease and indications, then he understands how to treat judicially and rationally, and he is a true practitioner of the healing God. So means that if you understand the disease completely and carefully, then you can able to solve the case. So what was her disease? Physiology or pathology? Then what was the timeline? why in 5th month 2017 she suffered with renal failure? Why not before this time, or why it was not after that time? So again, the disease for an allopath, Dr. Muktinder, I am getting the notifications in between from some doctors approved decline during annotation. You can,
Ignore it.
so should I decline, approve or decline? So for an allopath, it is the renal function test and urine output, and for the patient, it is only the pain abdomen which is not allowing her to sleep for a minute. And for a homeopath, it is totally different. For a homeopath, why she is suffering is more important than this or this, because these are the result of disease. So disease is actually why. So she has the pain in abdomen, which actually was due to some mental trauma, and that mental trauma was due to perception. This was physical, and she was only relieved by lying on painful side, and mental trauma was emotion, which was suppressed anger, and perception was her understanding that everything and everyone is wrong, that she was treated wrongly and she was given information wrongly, and they all are wrong. So we need sequential steps in every case to treat. The first is miasm and layer, then is the cause, then is observation and ruling out remedies. So miasmatic disposition, which is confirmed with your observation, if this matches, then you can easily qualify the right symptom. The right symptom which can take you towards that drug which is self-sufficient to reverse the pathology and completely cure the patient and bring the normal health. So from physiology to pathology, we understand that every cell has to go into these three phases, that is inflammation, growth and destruction. That is what is known as our psoriasis, psychosis and syphilis. So it is also written in the aphorism 74. I am not going to read whole of the aphorism. So among chronic diseases, we must still, alas, recon, and it must produce a revolution in the organism. This is the fight of the individual for the survival. Deprive some part of its irritability and sensibility, which is psora, or exalt these to an excessive degree, cause dilatation or contraction, relaxation or induration, that is psychosis, or even total destruction of certain parts and develop faulty organic alterations here and there, that is syphilis. So everything is written in the aphorism 74, that how the cell, that is unit of life, it behaves from psora to psychosis to syphilis. And if we understand how and why this has gone from one miasm to another miasm, or how this has changed its pattern, we can understand the person as a whole. So this cell, when gets affected by any of this emotional, nutritional, environmental, chemical, infections, genetic, immunological, or atmospheric changes, this loses its homeostasis. That is its equilibrium, that is its balance. and this gets injured, but still it tries to come back to normal by changing its biochemistry or increasing the fluid balance, fluid inside or excretions inside, and ultimately the target is going back, that is into the balance, by maintaining the homeostasis. But if the cause is very strong, like emotional, there is some grief, there is some anger, which is not even controlled with this maintaining the biochemistry, then it changes its gear. It goes from this directly into the physiological state, that is inflammation, which is seen in the sora, like on the body, in the inflammations, and in the mind, with some anxieties, fears, or apprehensions. And the cause still, if it is same and strong, then cell changes its gear from physiology. It goes into the structural change, maybe into the psychosis or syphilis, by creating a wall against the this factor, maybe emotional, nutritional, immunological, and trying to save itself, and again trying to maintain the balance by going into the psychosis. And if still the cause is strong and is unable to come out of it, then it tries to remove some part of it, and then tries to again maintain the life principle inside. So this is, in a very short, I try to explain the sora, psychosis, and syphilis, which is going inside the body to fight back from any of the disease, or the disease is not actually a disease, it is the disease of mind, which is reflected onto the body by just creating some changes, and actually and trying to spread the internal imbalance onto the body, so it can maintain life force or health. So ARF, I found it, this is a syphilitic and it is a dynamic one. So soric inflammation goes into syphilitic destruction. And the last part, in all cases of disease, the state of the patient's disposition is to be particularly noted along with the totality of the symptoms. If we would trace an accurate picture of the disease in order to be able therefrom to treat it homeopathically with success. So disposition is actually the person's internal makeup to react to some situation. We must understand that how the person is reacting and understanding the situation, and is coming up with his defense system. So this is a heart having many threads which are going deep into it, and this heart is very sensitive, but for every person this sensitivity is different. Some people, they are very sensitive to money, and some they are sensitive to criticism, some they are sensitive to position, some they want ambition in life, and some they can't go away from their respect, they are very egoistic, and some they are sensitive to friends, they cannot stay without them, and some they are sensitive to family, love, care, sensuality, reprimands, and sufferings. So every person has different sensitivity. So they lives with their sensitivity, and they can stay better and uh, uh, remain in a balance with their sensitivity, and accordingly when this sensitivity get hurt from any of the factors or any of the relations from, so they get upset and they react differently, like laughing of graphitis, shock of acid, phos, and picric acid, insolent Veratrum platina, the insolence of veratrum and platina is also a defense mechanism. The selfishness of calcarea floor, indifferent sepia, fearless anacardium, defiant mercury, then lamenting of alumina, anger of nux vomica and strychnine, hatred, and so many. So everybody reacts differently according to his sensitivity. And the last part is miasmatic disposition with observation. You have to understand the patient, what and how he is reacting in front of you. That is actual your observation. So observation with miasmatic disposition, though it was not clear in the video. So her energy was very low. She was in a constant pain. She was restless with the pain. Sometimes she was kneeling forward. Sometimes she was going back. But here, with this observation, we have to add this part, which was syphilitic. So what was the syphilitic in the case? So if I add to that the syphilitic restlessness, instead of just taking the restlessness, I have understood that and found in the repertory that anguish, pain in abdomen with. She was in a state of anguish. She was not able to rest for a while when there was pain in the abdomen. So simply I qualified this rubric, and another rubric observation, anguish, pain in abdomen with. Then I took the perception, which was actually her cause, that everything was wrong, and physical general lying painful side ameliorates. So I took these three rubrics, and maybe this video will be clearer. So I'll go to the follow-up just after 3 days. She was still brought with the support and catheter and cannula was still there, center line. Sir, her mother was smiling, so she improved a little, and then smile came. She was not so much of restless. She narrated further, she could sleep better. She started eating. So let us go to the next video. क्या नाम है? रुक्मिणी देवी, कैसे हो? So you can see the dialysis was stopped from the first visit, and then they removed this. I don't know why these videos are playing very slowly. Let us go to the next video. This is much better video. This is almost 6 weeks after the treatment.
और तुम्हारा पेट साइड में दर्द दर्द भी नहीं आता पता पेशाब कैसे तुम्हारा उसमें फिर उजला उजला निकलता पहले उजला उजला निकलता फिर और तुम
She told that there is no pain, only while passing the urine. First there is turbid urine and then the urine is normal. So I have forgotten the pain.
प्यास
She told that now I am not even aware of that there is pain. Only she complains of backache, sleep is normal, no abdominal pain, appetite good, sleep good, and she is sleeping better, and energy level is full, and the smile is there. And this is our last video.
कभी कभी कहाँ दर्द होता है और खाना पीना कैसे है पेशाब कैसे आता है जो तकलीफ महसूस होता है जैसे वो बताओ
The urine is totally normal, urine is full, there is no retention of urine.
सब ठीक है किसी तरह का कोई दिक्कत हाँ अब कोई दिक्कत
So everything is fine.
कैसे लगता है तुम्हारा
So what I observed is that every patient who get cured, the irresistible smile, this comes from inside. So now about the reports. Hemoglobin gone to 10.3. WBC is still high, that is 15,000. And creatinine came down to 1.4 and urea 71, and she was normal. And about the medicine, these rubrics: anguish, pain in abdomen with lying, amyloid, side on painful, delusion, wrong everything is. And then last rubric, position, knee on elbow. These rubrics I considered, and two remedies were coming up, calcarea and colocynth. But calcarea is more insecure and colocynth is more angry, and this colocynth has more suppressed anger and goes into the abdomen. So the remedy I prescribed was colocynth 200, which completely brought her back to the normal health. So now let us go to the chronic renal failure. So little brush up again. Gradual loss in renal function over years or months. In acute renal failure, we saw that this comes suddenly and it involves the whole of the person, and then causes retention of the waste products, and finally either it becomes normal or it rapidly disappears. But here the totally difference is that there is gradual loss. It may take years from creatinine to rise from 1.2 to 1.5, 1.7. This much time I have seen in patients, they take from 1.2 to 1.9 in a year. So characterized by increased serum creatinine level and urea, or decrease in urine output, or both, or leg swelling, which I have seen in maximum number of patients. There is vomiting, loss of appetite, and the last, which I have seen, a very important part, is confusion. So then causes of renal failure, chronic renal failure or CKD, diabetes, hypertension, glomerulonephritis, and polycystic kidney disease. Dr. Muktinder, between the reason for pauses is the requests they are coming, what to do about them?
I think they are referring to the voice annotation. You are talking about annotations.
Yes. So what to
So
do?
these nuisance creating people, they should not request but you just ignore it. There is no solution for now.
So
Because you are presenter now. If I whoever is presenter, that gets that annotation. I cannot see them. No one else can see. And in the meantime, there are few messages that there is sound quality, but here, as per my control concern, there is good sound quality. And you please check your local device noise, and you may use the earphones if you are not getting sufficient voice. But here from my side, it's quite excellent quality of sound.
it's okay.
You
So
please continue.
okay, causes of chronic renal failure, diabetes, hypertension, glomerulonephritis, and polycystic kidney disease. And then this chronic renal failure persons, they have only this hemodialysis. This is a simple dialysis to remove waste products like creatinine and urea. And then second is peritoneal dialysis, used to remove excess fluid, remove toxins, maintain electrolytes. And the last for option to them left is only kidney transplant. So now I am again starting with the second case, which is of chronic renal failure. This is Veena Devi, and creatinine was 10.21 and urea was 200. And case of chronic renal failure, Mrs. Veena Devi, 42, MRI findings of 4A2, not 19, tubular atrophy and interstitial fibrosis involving less than 10% of simple cortex. Tubules show prominent cystoplasmic vacuolar change and severe injury with epithelial simplification and loss of brush borders. Scattered hyaline and coarse granular cast and sloughed epithelial cells are seen in tubular lumina. Focal chronic interstitial inflammation. Arteries show medial thickening and sclerosis, while arterioles show vacuolization in smooth muscle cells of the media. So the chief complaints here were totally different. Urine scanty in drops with swollen abdomen and frothy. After dialysis, froth in urine decreases for 2 days, then reappears. So she used to be better only for 2-3 days because the dialysis was done twice a week. So taste was bitter, even water tastes bitter, nausea constant, have to keep cardamom in mouth to prevent nausea and bitterness. So appetite was decreased, no desire to eat, vomits immediately if eats forcefully. weakness, could not even hold glass of water, sleeps and dreams, profound sleep, not even gets up to eat, dreams of dead relatives and animals. So there were a lot of information. So let us go to the history of this patient, how she has gone into this state. Since 14th June 2019, she was experiencing nausea before the urge to urinate. And if she tries to control her urge, she would vomit. So this was a rare type of presentation. On 3rd July 2019, cough plus coryza came. On 4th July, fever up to 104°F, body ache, bitterness in taste, and swelling on the body came. On 18th July 2019, she was admitted to the hospital for a week. Creatinine gone up to 3.29 and urea 67. On 5th August 2009, she was admitted again in the hospital for 4 days. Creatinine was 6.63 and urea was 191. In the middle of August 19, RFT gone above 11 and urea 250. With breathlessness, so dialysis was started. So the life situation, which was very important, she lives in a nuclear family with her husband, son, daughter-in-law, and 3 years old grandson. Her son, 25 years old, is partially MR due to head injury, which he suffered at the age of 11 years. She married her son at a young age of about 19 years while he was studying to settle him early with family life. So because the son was MR, so because of childhood injury, she thought that how she can settle her son early. So she made the possible by making his marriage at the early age of 19. So stress related to son and daughter-in-law disputes. So there were quarrels between son and daughter-in-law. She tried to defend her son by marriage, but it gone opposite. So preferred to stay at her parents' house most of the time since May 2018. She would stay there for many months and would stop talking to her son as she judged her son's poor brain function. So it was that she was trying to manage the son's MR condition by settling his family life. But daughter-in-law came to know about his condition, and then she was quarreling because of this, that why this was kept hidden, that her husband is having this retardation. When daughter-in-law would not talk or avoid her son, he would get very upset and aggressive, and he will express all his anger on patient. In May, June 2019, son started saying that I would kill myself and stopped eating because daughter-in-law was not talking to him and wanted to leave him permanently. So she got scared for her son that he may commit suicide. She considered his son as her lifeline and she said she cannot live without him. She says that if something happens to him, she won't be able to live for even 1 minute. So she did many efforts to save their relationship, fulfilled the demands, apologized to daughter-in-law and to her parents. She tried to hide her many mistakes so that there is peace at home and she won't argue with her son. But nothing worked. So she tried all the efforts, but nothing was working. So nature, she was very sympathetic. She cannot see anyone in problem, even her maids. She would help them financially and won't expect the money back. किस्मत में होगा तो मिल जाएगा वापस. She likes cleanliness a lot. in her whole locality, her house, in the cleanest house. She is soft and yielding. So about physical generals, thermals, she is chilly and thirstless, stool constipation, sun headaches. Past medical history, she has typhoid in 2016, sepsis in uterus 2017, and pneumonia 2018. So nephrologist told dialysis will work for some time and this plan for transplantation. So how to solve? So again, the questions they start in everyone's mind. So can we cure her? Can we save the kidneys with dialysis and allopathic medicines? Our remedies will work. If yes, then how? So these were the questions in my mind also. And further the question, why she suffered with renal failure only and why she suffered in 2019 only. So that is what actually is known as process of disease, that is miasm. So this I have divided the syphilis into two. One is killer syphilis and another is non-killer syphilis. And killers are again divided further into fast and slow, and then non-killer are recent and old. And fast killer like cancer with metastasis, like squamous cell carcinoma, ulcerative, acute myeloid leukemia, cirrhosis of liver, gangrene of intestines, lung collapse, and nowadays this COVID-19 is also a fast killer. Slow killers, this is chronic renal failures, the lingering disease. So the patient keep going to the this dialysis and is struggling with the fate and finally goes into decline. Many patients, they go for this renal transplant, but because the body has the syphilitic environment, if it has already damaged the existing kidneys which nature gifted to them, the transplanted kidneys, they also goes into decline and destruction, they take away, and finally the collapse comes. So chronic myeloid leukemia, then thalassemia major, etc. These are slow killers. So syphilis, exaggeration, distortion, perversion, hysterical, destruction, autoimmune, where she lies. So these are the mutations which occurs in the chronic renal failure. So if there is no dialysis, waste material inside body increases, toxicity and complications they start, and renal encephalopathy will show, and poor vitality, and finally the death, which I started with, that renal failure is actually a slow death. So now about the analysis, how to do the analysis, how to understand this patient. Again, that which I told, the aphorism 3, if we understand the process of disease, that is miasm, we are able to understand the person as a whole and then can be able to prescribe for the patient. So if we do the analysis, we understand that she is a timid, fearful, sympathetic, fastidious constitution in her soric or sauropsychotic condition. When she got a situation that daughter-in-law wanted to leave her son, and then son wanted to commit suicide, which was actually the cause of her suffering. Then how to solve and analyze and to reach to some rock solid symptom or rubric from where we can enter into the case and prescribe the remedy for this patient. So CRF is physical syphilis. If there is physical syphilis, there has to have some origin in the mental, that is mental syphilis. This should be there. So again, if we understand the same process, the disease is why, then urine scanty and frothy, this is physical, which was due to some mental trauma. And again, that mental trauma was due to some perception which he had understood from some situation which she faced in her life. And urine scanty frothy, again physical, and also having associated symptoms like bitter taste, weakness, and nausea. And then mental trauma, both was their emotions, fear and grief, because fear that son may commit suicide, and grief that if he will commit suicide, how the life will go and how she will live. And son and daughter in your relationship was actually the cause of her suffering. But what was her understanding from this situation, which was troubling her constantly and putting her into dis-ease that son may commit suicide? So analysis, if we do the physical journal, just analysis and considering the physical journals, urine frothy, urine scanty, taste bitter, nausea with. So two remedies are coming up, like lycopodium and Chinam sulph. So here we have considered two parts, this only the kidney failure or the symptoms of the kidney, just an exercise. And if we combine these two, urine frothy, scanty, taste bitter, nausea with, and mild fright fear aggravates ailments from, then only remedy coming up is lycopodium. So here we have considered the second part also, that is limbic system, which are emotions. So we have considered the fright and fear as well, the expressions of the renal. So, but still these are the numeric totalities. So what still written by Dr. Henneman in the footnote 9, most severe disease may be produced by sufficient disturbance of the vital force through the imaginations and also cured by the same. So why this imaginations? Because the son was just saying that he will kill himself. It was not that he has done any of the attempt to commit suicide. So she took that imprint and started understanding from that. So this was there, which was disturbing her completely as a whole. So this was her disease. If son will commit suicide, she won't be able to live without him. So this was related to her existence. Her existence is only with her son. So she was presenting and understanding the life on this planet with her son only. So she thought that because she was so much connected as having only child. So her existence was at that stake, because if she will lose her son, she has to give her life also. So kidney failure, if we understand the limbic system, this kidney failure cannot occur without the involvement of the upper part. That upper part is what? That is emotions. So the emotions, it can be any anger, fear, shock, some mental trauma in the form of grief, anything can cause. So that is disturbance of the limbic system. And if we go further from this limbic system to upper side, then the cerebral cortex, where lies the renal relay center. This has given information and generated the emotions which are in a flood, and then these emotions targeted the kidneys. And again, we understand above this renal relay center, there are 5 senses which are present, which can be also the part, and above all, the genes they are present, which are on the top, and they react to the perceptions only. So mutations, they occur because of the perceptions, and these perceptions, they create the environment. So faulty or wrong or poisonous environment is not created by this limbic system, not by the cerebral cortex, not by the senses, but this is done by the genes, which they react from the perceptions and are responsible to disturb the whole of the system. So here, if we take the physical generals, we consider one part, and if we consider emotions along with the physicals, and then we take the understanding, and finally, if we consider the taste also, these all will not hit here. So it is up to us that from where we should pick and what should we pick. In deep-seated diseases like this chronic renal failure, I have seen that prescribing on emotions or understanding or even the taste, we can add the rubrics of taste because they are directly connected with the digestion and poor renal function, because the waste material inside the body in the form of creatinine and urea causes toxicity and the digestion become very poor. So we can take the rubrics from this. But if we have hit here in the genes and we have understood the perception of the patient, then the person surely improves. So when the person is here in the Sura, there are many symptoms, and when the person from the Sura, it goes to psychosis, this is like triangle, the symptoms they start reducing, and when finally the person goes into the syphilis, it is like the edge of the triangle, you will get a very few symptoms, or the few symptoms are sufficient to prescribe even. So you might have seen that many drugs they cover the psoric part, and few drugs or the lesser drugs just qualify the pseudo-psychotic part, and only the few drugs are there which they qualify the syphilitic part. So syphilitic rubric, it should be the PQRS, whatever is in front of you, you can understand. So here I took the rubric delusion exists in another person she is, because she was living her life in her son. So the remedy, only remedy was present in this rubric was pyrogen. So pyrogen 200, one dose was given on 1st 9 2019, and this is the follow-up video. I have not taken the first video.
ठीक जो जो हुआ वो बताओ। तो पहले से कमजोरी कम है। पहले जैसे यहाँ से वहां तक जाना होता था, मुश्किल से जा पाती। सिर्फ 4 राउंड 5 राउंड लगा दो, नहा लेती। जैसे पानी भी आप पहले माप के लेती आप अपने।
So energy level improved. She can now walk. She can bathe herself.
काफी काम करते थे। उसके बाद अभी कराया नहीं। जाने से बहुत से एक रोटी डेढ़ रोटी कभी खाने में आती है। हम तो कोई भी खा लो, कोई भी रोटी है, हम कोई नहीं हजम हो रहा। चलो ठीक है। लेकिन एनर्जी लेवल बढ़ गया। हाँ, बॉडी अपने आप चढ़ गई, बॉडी चढ़ने लगी। हाँ, तो हमारे बीच में ना पौड़ी नहीं चढ़ पाती, इस पौड़ी है वो भी चढ़ जाती है। एक बार चढ़ जाऊंगी, ऊपर है जाना है। हाँ, ऊपर है सब।
So she told that she can go onto the second floor, And
हाँ तो हमारे इस बीच में भी ना पौड़ी नहीं चढ़ पाती, पौड़ी है वो भी चढ़ जाती है, एक बार चढ़ जाऊंगी, ऊपर है जाना, हाँ ऊपर है 17 पौड़ी, वो भी चढ़ जाती है, 2 मंजिल एक साथ नहीं जा पाऊंगी, इसे एक मंजिल जाना होगा, हाँ तो यही मुंह से मैं परेशान हूँ, सबसे ज्यादा कड़वाहट नहीं कर रही, और पानी का स्वाद नहीं अच्छा लग रहा।
so still she is complaining bitter taste of mouth and puffiness you can see on the face.
सब कुछ सही हो गया है, उससे तो बहुत ज्यादा आराम है, उससे तो मैं अपने आप में नहाना ना लूँ। पहले जैसे हिंदी की लेटरिन में बाथरूम भी नहीं जा पाती थी, लेटरिन तो उसमें नहीं जाती थी, बाथरूम अगर जरूरत पड़ती तो उसमें तो अंग्रेजी ही लेटरिन में जा पाया, अंग्रेजी लेटरिन मुझे उठना मुश्किल हो गया था बीच में, अच्छा तो उसमें भी उठना मुश्किल हो गया।
So she was totally dependent. She was not able to go to the toilet by herself. She was not able to bathe. So after the medicine, they did not go for dialysis, and still the energy levels improved. She could do her daily course at her own. Let us go to the next video. So she told that fever, cough, and cold came.
अच्छा और डायलिसिस कराए परसों शनिवार को 7
So creatinine came down to 4.5, and the swelling reduced. She suffered with cough, cold, and coryza.
रात को ना दिन को सोती हूँ मिल जाती है, वजन भी काफी घट गया है, चिपकाई है।
So weight came down from 81 to 72.
चलने लगा था, जैसे अब एक टाइम खाए कल दोपहर में 1.5 तकलीफ खाए, कल शाम को अधिक खाए, अब सुबह कुछ भी नहीं खा पाए, जितना थोड़ी सी चल गेहूं की दाल खाए, उसको सुबह में खाना तो बिल्कुल सादा खा रहे, तेल एकदम और कुछ बताओ, पेशाब कैसे है?
So she had scanty urine. Now the urine is normal. Let us go to the next video.
उधर चेंज करने के बारे में सोचो दुकान को छोड़िए कि सब 200 रुपए खर्च के क्या होगा वो तो
आया तो डॉक्टर को डाल दो इससे साथ चेंज कराना आप दोनों ने ये मेरी
उस वक्त 11 पॉइंट था के बाद
10 पॉइंट
10 पॉइंट इंक्रीज हो गया उसके बाद आपने दवा लिया
की दवाई बंद कर दी
उसकी दवाई एकदम से बंद कर दी आपने बोला था लेते रहो लेकिन फिर भी बंद कर दी
सर पहले आपको खाएगा
So she told that even nephrologist was advising her to go for transplant when the creatinine was 11 and she was not responding to the dialysis.
पेशाब कैसे
सब तो खुल के आ रहा है पर हल्का जा रहा है
और जो कैसे रिलेटेड तकलीफ बताओ
वो तो नहीं अब तो आया अब इससे नॉर्मली कमजोरी है बाकी तो चलना फिरना
So you may see that eyes, they are normally opening now.
पेशाब कैसे
सब तो खुल के आ
जो कैसे रिलेटेड तकलीफ बताओ
वो तो नहीं अब तो आया अब इससे नॉर्मली कमजोरी है बाकी तो चलना फिरना कोई
खाना पीना
So first follow-up, they did not go for dialysis. I did not advise them anything because her nausea decreased, had no vomiting, appetite was better, she could sleep normal, and creatinine came down from 10.21 to 8.01. Urea came down from 200 to 146. Second follow-up, bitter taste reduced further, appetite increased, sleep normal, urine output was much better, creatinine and urea came down from 7.6 to 7.6 and 121. Third follow-up, for froth in urine decreased, appetite better, weakness reduced, can sit on feet. And then next follow-up, no bad dreams, sleep is better, weakness reduced. And this is the chart how she this creatinine reduced from 10.251 to 7.6, 3.4, 2.5. Every time the creatinine was coming down 0.9 and finally it came down to 0.7 and urea 15 and HB from 9.4 it gone up to 12. These were the reports 10.21, 200 and then 7.6 creatinine and then 3.4 creatinine, urea 98 and creatinine 2.5 and on 3rd October it was 1.8 and urea 50 and then creatinine came down to 0.9 and finally 0.7 and 15. So this was the case. So in acute renal failure, chronic renal failure, what I have found is that we have to understand one thing, that is miasm, which is the process of disease. Process of disease means that how and why the patient has gone into this condition, which is being governed by the situation which he faced. Then cause and timeline, they are very important. That cause should be recent, relevant, and should be very strong. There, if we take the case history, then many times patient gives many type of different causes. But it is our duty to understand if that cause is actually relevant or this is such a strong cause which can take the life of the person or can take the person into slow death by shutting down the kidneys and finally bringing or inviting the collapse. And in chronic renal failure, I have proceeded in all my cases from the PQRS, and in acute, I take maximum this modality because here The case is very dynamic, and modalities, they help a lot in understanding the right picture of the patient and entering into the case. And with the dialysis, the chronic renal failure, this becomes more adynamic. So here we enter, we should understand the PQRS. Then our very important part, these are the tips which I have understood, that creatinine is a waste produced by muscles of the body from this muscle mass. This has been produced, and urea produced in the liver by nitrogen cycle, and one is nitrogen content of the urea in the body, and uric acid metabolic breakdown of purines, that is nucleotides. So the tip is that creatinine should reduce first and urea should increase. It is like hallmark in all the cases I have seen. Those who are improving, and your remedy, if it is right, then creatinine should come down and proportionately urea should increase. And if creatinine increases and urea decreases, then immediately change the remedy. Don't waste the time in repeating or changing the potency. This will not yield to the cure. So many a times why we don't get success in these cases, we think perhaps the potency is not right, or sometimes we think that repetition should be done faster, or sometimes we think that if the urea has gone down and creatinine has gone up, it means that the patient has started improving in one way, and definitely in the next visits the creatinine will also come down. But I have seen very clearly that once the creatinine has started going up, it means this is the alarming sign. You should take care of the patient, you should understand the history properly, and you should find out the appropriate and right rubric which can run through and through, and then you should prescribe and change your remedy. When case is improving in right direction, uric acid will increase at the last. So this pattern I have seen: first the creatinine will go down, blood urea will go up, and then blood urea will go down, and then uric acid will start increasing. Here you need not to interfere. Here you should stay with your remedy, and this will bring the person or the patient to completely normal state. And the finally is HB should not fall down after right remedy. If this creatinine and urea, they are coming down, but still the HB is also coming down, this is again means that destruction has started involving the this blood. So if the blood is destroyed or hemoglobin is going down, it means that the patient is again going towards decline. You should reconsider your case. If recoverability is correct, patient will himself manage, stop dialysis and allopathic drugs. So in these two cases which I have discussed, I did not tell them to stop the dialysis. I did not tell them to reduce or taper down the drugs. I just gave the remedy and kept myself on the side to wait and watch that how the body is reacting and how the patient will manage. But if the simillimum is correct, this will do the total corrections and will bring the energy back. That energy will be felt by the patient as well, by the relatives, and they will start interfering into the drugs and this temporary measures by themselves, and you will get the fruits back. So these were the two cases which I thought to discuss. So this is all about today's lecture. Dr. Muktinder, are you there?
Yeah, thank you, Dr. Rajesh. It was a good presentation.
Yes.
So there are some questions you can read directly and answer the relevant questions.
Okay.
Till then, all the participants, they are invited for their questions and queries. You can ask your questions or you can just type your question in the chat box. So you can get your answers from the speaker. So there is, I think you read, Dr. Rajesh, you read some chat. There are some questions.
Oh, I am not able to see that.
In the lower side, there is a chat option, chat, extreme right, lower right screen, chat.
I'm just trying, just wait.
So the one question I'll read you, what will be the pathological rubric for ARF, CKD, CKF and glomerulonephritis? Acute renal
Sorry.
failure, chronic kidney failure and glomerular. Is there any pathological rubric?
For this acute renal failure, I have never tried to find out or gone through the pathological rubrics. I have just tried to find out the physical journal because I'll suggest here to go from the physical journals because the dynamicity in the disease because of acute renal failure is too high. So the patient will always present you uh, with different and strong modalities. So instead of going to the pathological rubrics, I'll suggest you to go from the physical journals.
One of Dr. Rajni Pachauri has asked that only one dose is given or repeated medicines were given.
Fortunately, in these two cases, I did not get this any situation where I got the need to repeat the remedy because once I prescribed the remedy, then patient shown every time improvement. There was not a status quo. So in the first case, there was no repetition. In the second case, again, it reached to 0.7 without repetition of the remedy. But yes, I repeated the remedy. Once she this law in the lockdown, she left my medicine and she started medicine from nearby homeopathic doctor, and again her creatinine level started going up. And then I reviewed the case and gave the remedy, and again the creatinine started coming down. So that again reconfirmed my remedy that she was a patient of pure pyrogen. And if you will see into the history clearly, you might have seen that earlier in 2017 or 16, she suffered with sepsis also. So she was a clear picture at that time, syphilitic picture of pyrogen. So once I repeated there.
There's another question, which potency, high potency or 200 in kidney
In
disease
these
cases?
two cases, I prescribed only 200 potency, but till now I have solved many of the renal cases. Yes, there is need of this 10M or this 1M potency also. It depends if the patient is having more restlessness and more this complications of this nausea, vomiting repeated. So then I give uh, doses more and I go to the higher potencies as well.
Total how many cases you have treated and can you give the overall success rate of homeopathy in chronic kidney
So
disease?
I'll say that if I'll take the percentage, so my success rate right now is 50 to 60%. The rest of 20 to 40%, 20%, they are in terminal state where the HP goes very low, less than 4, less than 5, and every time they have to take the injection for this to raise the HB. They are more complicating cases because every time they are showing some signs of improvement, and later it has been interfered with the allopathic system with some new drugs. Even our remedy can manage the already prescribed drugs as well, the dialysis also. But if that something else is done, so then it breaks the this uh, process of reversal, and the person goes into decline. So the terminal cases, yes, I feel too much difficulty still, and 20 to 30% of cases I have seen that if they go to the other systems as well, as patients, they commit mistakes by adding on some other systems like Ayurveda or some other Ghrilu Nuskhana type uh, remedies, then they can interfere and spoil the case. Hello.
I think there are no more questions, and we are already uh, running. Some people has typed the particular cases, which I am not thinking that it is right to discuss personal cases. So someone has asked that his wife is also suffering and can you cure him? So these personal questions, I think, on this platform should not be taken. Or any other thing, if anyone asks about today's presentation, uh, someone is just typing that, is there any particular approach for nephrotic syndrome?
Uh, for nephrotic syndrome, I go for constitutionals, and for this acute renal failures, I take the acute state of the person, and from for chronic renal failures, I go through the PQRS. So I just want to convey this thing to all the doctors, that you try in your practice, because I have seen in almost all the cases the pattern of results will come like the same as I explained. And then the second part is the existence issue if it comes into the patient. So that is actually the reason for kidneys to shut down and go into a state of this collapse. So these are my personal experiences.
Someone is asking that in acute kidney failure, if we give acute remedy, if the patient has recovered, then do we need to give GCS or not?
Uh, I have not seen the patients, those who have recovered from acute renal failure, because this is a major organ involved. So until and unless you are very sure that now there is need to be interfered with another drug, you should not stop. You should not do that. So if the patient goes into a state where the patient is coming up with totally a different set of symptoms and different, and you are actually understanding and observing the change in energy level, and you are sure about the remedy, then you should do that. Otherwise, this may spoil the case and again re-invite the same process of the disease, and you will see the quick fall in the patient.
So someone is asking about the Pradeep Singh is asking that LM potency in renal failure case.
Uh, uh, I don't have any experience of the LM potencies. I have never used them, and so I am unable to answer about it.
Are there more rubric for existence conflict?
Yes, there are many rubrics in the existence conflict, delusion, existence, exist in another person, delusion, exist two persons, delusion. This I'll let you know. There are many rubrics which can be used, but delusion, existence, doubt, if anything had. So this is Agnes Castus, which has also given me good results, which this remedy is a very aloof remedy, very sad remedy. And if they start having doubt about their existence, then this is one of them. And then another remedy, that is Thuja, delusion exists any longer, she cannot. So she feels that she cannot live any long without whatever the condition or circumstances or the cause is there, or the situation. So Thuja is then surroundings exist do not. This is again done by three remedies: Agnus castus, Nux moscata, and Pulsatilla. So I did not get results with Pulsatilla, and I never got success with Nux moscata and Pulsatilla. I never prescribed these remedies. But Agnus castus and Cannabis indica is one of the remedy which has given good results in the cases.
So I think it is 6:20 now. So we thank you on from the behalf of CEC committee and scientific committee, IIHP, the whole leadership, Dr. M.A. Rao sir, CEC committee, and whole of the IHPN who have enthusiastically participated in this event today. So now I would invite Dr.
Uh, I
Tanvir
just
Hussain.
want to say thanks to Dr. M.A. Rao sir, and thanks to Dr. Kochhar sir, Dr. Chandok sir, and thank to Dr. Muktinder and whole of the IHP team, and Dr. Tanvir. Thanks everyone.
So now I
Thanks.
invite
Special say.
Dr. Tanvir Hussain for the vote of thanks of today's event.
Thank you very much, Dr. Muktinder Singh. First of all, I would like to congratulate Dr. Rajesh Sofat for his wonderful presentation. He has very nicely started with acute and then chronic renal failure. He had completed almost all the aspects clinically which are important. And very nice presentation, Dr. Sofat. We would see in the future also to listen more from your side on another topics also. So thank you very much for your today's nice presentation. And after that, I thank first of all our respected Dr. V.K. Gupta Sahab, who is our President Honor. Then our respected M.A. Rao Sahab, who is the backbone of IIHP nationally, respected M.A. Rao Sahab. And Dr. Muktinder Singh, you are also, I also thank you very much because of taking all the pains. You are taking all the pains for organizing such nice webinars. Dr. Sudhanshu Arya ji, the webmaster, I always thank him because he's also taking, spending much of his time to upload all these videos on YouTube. And I thank all the CEC members of IIHP, Central Executive Committee members, and members of Scientific Committee of IIHP, all the audience who have given their qualitative and quantitative time to listen to today's webinar. So thank you one and all. Thank you very much. Over to Dr. Muktinder Singh.
Thank you very much to everyone for listening, and thanks once again.
Yeah, actually, after vote of thanks, I'm giving an announcement that we'll be uploading this recording on YouTube very soon. Dr. Sudhanshu Arya will do his work. I'll just forward the link to him. And as you are all aware that these days homeopathy is under so much of discussion in this COVID era, and there are so many good and bad news for homeopathy. Homeopathy is not being permitted, and there are so many concerns that homeopaths they are, despite doing very good, we are not getting that official recognition. But on the other hand, many people they are releasing that these messages viral, that particular medicine for a particular situation and as an alternate to oxygen and all these. So these, why IAHP has to stand on this is that this kind of messages, people now are in panic. So they will try everything. But we all know that a same remedy cannot act on everybody. So this might bring in the long run a bad name to homeopathy. So we as a qualified homeopath should always avoid and should not promote this kind of practices. So we should educate the patients that as they are told that not to take any allopathic medicine without prescription of a doctor. Same way, any homeopathic medicine, if has to be consumed with the consultation with the qualified homeopaths, because we know in the past there has been malpractices with that these retired people and unqualified people have been practicing, and they have been giving prescription for so and so like patents, which has not done anything good for homeopathy. If you are having some good thing, you should make a presentable format, and it should be on a research basis, even if these are clinical trials. So after getting verified, and you should present. This is how allopaths and the scientific community work. If you have some good result, we should have a habit of recording our cases and keeping the record of our cases, and then presenting them into the medical journals for the profession. So this is a good practice. So I invite all the youngsters to come forward. IIHP scientific committee is taking pain, and very soon will be uh, designing some programs so that all the clinicians, all the youngsters, they participate in the research projects. They learn how to participate in the research projects. So with that, I again wish you all the best in this hard time of COVID era. And I'm really very thankful to our leadership, who is very dynamic, who is very proactive on all these issues. We have a detailed discussion, and then we release some guidelines and advisories. So I again tell you that be cautious, because this era is very crucial time, because disaster act is in force. So you should avoid making shallow claims. Your claim can make a problem for you in future. So there are many senior homeopaths, not going into the detail. Yes, Dr. Prableen Singh has asked to have a webinar on COVID situation. Will be most probably next webinar will be holding on the same topic. With that, I am ending this meeting. Again, a big thanks to our leadership and Dr. VK Gupta and Dr. Rao sir and whole of the CEC committee and scientific committee. I again thank to Dr. Rajesh Sofat sir. With that, I'm logging off. Thank you all.